one of those areas that's always intrigued me is the structural issues. I mean, this goes back, I mean, I did a year of osteopathy about 30 years ago because I saw that the chiropractors really help people, and I wanted to understand why. But this has the idea of structural integrity, because it's huge. It's very big, just because even if you're in fairly good shape, you have old injuries in areas where muscle and connective tissue is tight, and that really interferes with lymph drainage. But these days, and it's something I've just learned about probably, I think, maybe 5 years ago. So things keep changing. Is the real issue of hyperlax tendons, or people talk about Ehlers-Danlos syndrome, but a lot of people have ligamentous laxity, meaning you're a little double jointed, or you just, if you're 60 years old and you don't work out and you don't do yoga and you can still, touch the floor easily or palm the floor, you're probably a little on the hyperlax side, a little bit more ligamentous laxity than normal. Now, again, this is not the ligamentous issue isn't the problem. The problem is there seems to be genes that kind of move along with the ligamentous laxity that have to do with how your body controls inflammation. And the issue is when the inflammation goes up, unfortunately, the ligaments also respond to inflammation by getting a little more lax. I mean, part of this is built into the system. That's why the pelvis can open during pregnancy, is because your body releases a bunch of inflammatory chemicals that are not bad for you. That's what's supposed to happen. Remember, none of this inflammation is bad. It's just the failure for it to turn off at the right time. So things called, this issue of ligamentous laxity is something that we all have to think about. It can affect your autonomic nervous system. A lot of people with severe MCAS, severe mast cell activation, or lots of autonomic problems like POTS, the postural, like when you stand up and your heart starts racing, a lot of these people also have this ligamentous issue, which is affecting the very top of the neck and where the head sits on your neck. And that area, when it's lax, can really irritate the brainstem. Now, this is, again, a huge deep dive. I just want to give you a hint of things to look for.